Good morning, everyone, and thank you for joining me on this incredibly special town hall. I'm so thankful and honored to have Congresswoman Madeleine Dean joining us today, taking time out of your really busy schedule, I'm sure, to be with us is very much appreciated. Thank you.
Thank you, Patty, for inviting me. I think it's very neat that you're doing these town halls. So thanks for including me.
Thank you, of course. And so for those who are living under a rock, Congresswoman Madeleine Dean was elected to Congress in 2018, and she represents Pennsylvania's 4th District. And prior to that, she was a state representative here in Pennsylvania from 2012 to 2018. So she spent a lot of years in public service, and we definitely appreciate that. Especially having your voice in Congress as a woman. First off, I just want to say I'm really thankful to have that. And I'm gonna just quickly mute people here. And so the reason that I was so excited to have you on is because people are wondering, what actually is going on in Washington? What is Congress doing for us as it relates to the coronavirus? And there's a lot of conflicting messages and you should be able to get this and people aren't able to get that. So I'm thankful that you're here to kind of help clear this up for us and tell us what you're working on. So we know that there's been a couple stimulus packages already as it relates to the coronavirus. And those include like the PPP loan and the EIDL loans, as well as unemployment money for people who are affected by the coronavirus and the shutdowns nationwide. Have all of the items in those stimulus packages been implemented so far that you know of, or are some of them still kind of rolling out as we speak?
Again, Patty, thank you for including me in your conversation today. I'm at home in Jenkintown, where I live. I represent Montgomery and a part of Berks County. And we have been particularly hard hit here. We were one of the original, if not the original epicenter for coronavirus, started in Montgomery County. Now, as you know, of course, the Southeast region has been particularly hard hit, among other counties, of course. In Montgomery and Berks County, we have over 400 deaths as a result of coronavirus, and of course, thousands of folks infected and thousands more we don't know of. So far in Congress, just so people are clear, and you're absolutely right, it's so unclear, first of all, the complexity of what is happening to us, both in terms of our public health and in terms of our economy, but also what has happened legislatively. These are big, complex bills. So the 4 bills that we have passed so far, the first 2 we considered emergency bills. Dating back to the very first one we passed was in March the 4th. That one was called the Coronavirus Preparedness and Response Act. And that was, we thought that was a lot of money. That was $8.3 billion to go to vaccine development, SNAP, small business assistance, state and local government dollars. As I said, that was an emergency. We had to get some money out the door to connect to states, locals, and to public health. Right after that, we passed the Families First Act to get paid family leave, to get paid sick leave. Now that's a brand new thing. That's history making in our country, and we were proud to be a part of that. It also included money for school meal programs, SNAP, and again, more small business loans. But then what everybody knows about is the big bill passed on March 27th, the CARES Act, $2.2 trillion, a big chunk of that to small businesses and businesses, another big chunk of it to hospitals, some money more for testing, $30 billion in there for schools, about half of it for K through 12, about half of it for higher education, and some money for testing, though I believe not enough. And we saw what happened with the PPP and the unemployment compensation. The unemployment compensation was, I think, delayed. It took a while for Pennsylvania to be able to add the new federal $600, as well as the new eligibility. Again, really exciting that it took a tragedy to actually add other eligible folks to unemployment compensation, sole practitioners or gig workers or entrepreneurs or Uber drivers. But that took some time getting that up and running in our Department of Labor. And then we saw immediately, very quickly, the SBA monies were used up. We went back Thursday, a week ago, and passed a fourth bill, which was a supplement to the CARES Act. We were determined in our caucus, I want to really make this clear, we were determined in our caucus to make sure that it wasn't just more money for SBA loans, which are vitally important, but that it also included money for hospitals. We know all of the conversation around PPE and the lack of it and the need for more of it, but also $25 billion for testing. I believe that our way out of this is to test in the broadest, most equitable way in order to isolate the disease, trace the contacts, and therefore limit the spread. Has everything been implemented? I don't want to say yes too handily. I believe access to all of this relief is in place, but it has not been without bumps and difficulties.
Sure.
I was talking to folks just last week, lenders who said they had 50,000 applications, completed applications, waiting in the queue for SBA relief. So while things have been implemented, and relatively quickly, when you consider we're talking almost $3 trillion worth of relief, it has not been without problems and not been without gaps. So there's more to do.
Yeah, and I appreciate that. It's nice to see Congress working together on something so important. I think partisan politics has kind of exhausted people, and it's really wonderful to see that is possible in emergencies, that everybody can work together and kind of put the public's best interests at heart. So thank you for that. But also thank you for fighting and standing firm on the things that are important that, weren't originally in there. So it is a give and take, and definitely, we appreciate you doing that for us.
Thank you. And those bills were bipartisan, remarkably. Yeah. I hope our next one can be. It looks like we're breaking down, but they were remarkably bipartisan.
Yeah, that is true. Absolutely. Remarkably bipartisan is a good way to put it. I've been hearing some questions about, I'm sorry, I get little notices at the bottom, people wanting to jump in. So I've been noticing questions regarding the $1,200 payment. That is usually on my end. Thankfully, it's not today. So there's been questions about the $1,200 payments that I'd like to just clear up. One of the main ones that I've been hearing is that it's a loan and we have to pay that back. Does the public have to pay back the $1,200 that they received in the stimulus money?
That's a great question. The answer is no. The direct cash payments to individuals at $1,200 and children at $500 is direct cash, not as a loan, not to be paid back. The arguments moving forward, and I thank you for the chance to clear that up, because of the complexity of all these different layers of relief, whether you're going to access PPP or unemployment comp and the direct cash. Direct cash is intended to be a very small bridge to folks in the beginning of this crisis. You can see now the arguments are that once is not going to be enough for that. And I have introduced legislation, co-sponsored legislation, to make sure that we do more direct cash in a continuing way, and not to be paid back. It is to be a bridge through this collapse of our economy. And I'm happy to talk about that, but the great question.
I'd love to, because, there's, it's kind of hard to tell what's rumor and what's fact. And, there's a rumor out there that you are working on payments like that. So I'm happy to have you here to clear that up, because some of what I've heard is it's going to be $2,000 a month to each person over the age of 16, I think it was, or 17, somewhere in there. And of course, there's also, the fight of, our state's going to get money. because their budgets have just been devastated by the lack of revenue. And there's been talk out there that, maybe they should claim bankruptcy and kind of get out of it on their own, which of course I think normal people are worried that getting out of it on your own is going to be a huge tax increase, in the coming years, which of course is going to devastate people. So I'd like you to kind of talk about those two issues, and if they're in this current bill that you've put forth, or if they're coming down the road that you see.
Thanks for those questions. We expect to go back to Washington perhaps next week. You saw the Senate is there now, and sadly not there arguing, debating, or passing legislation having anything to do with coronavirus, which I cannot understand. We are going to be going back next week. We think that it could be on hold. We were actually asked to stay back because Washington was hitting its peak. So to bring 435 members of Congress and all the staff and everybody else, it seemed irresponsible. When we go back, we hope to pass, whether it's next week or the week after, a fifth bill, which we're going to call CARES 2.0, so just the confusion of all our numbers, to try to fill in some of the gaps that you're talking about. So for example, on the direct cash, what I have proposed, and mine is one proposal, and there are others that are similar. What I have proposed is a continuing direct cash payment to adults. Well, actually, the one that I've co-sponsored is $2,000 per adult and per child, not a discount for children, and include all children, not excluding the dependent children, the 17-year-olds who are claim dependents. So $2,000 per person, and then a quarterly revisit of the direct cash, continuing direct cash back out, and you tie it to unemployment numbers. So some sort of a benchmark. As unemployment, we hope, numbers will go down, the continuing payments on a quarterly basis would begin to go down. There's another proposal out there that I'm forgetting who has it, that it would be $2,000 per adult, $1,000 per child in a monthly way, again, connected to unemployment numbers. I think there's a growing belief that once and done is never going to be enough. I think literally, I was talking on a conversation yesterday with former Secretary of Treasury, Jack Lew, who said 8 weeks ago, he did not see the depth and the breadth of this. Mm-hmm. None of us did going into it. So while I'm proud we got emergency relief out for Congress relatively quickly and very bipartisanly, we know we've got to do more. So that's the direct cash piece. State and local government left out entirely, grotesquely left out, and for Mitch McConnell to have flippantly argued that maybe states ought to just go bankrupt, I think is extraordinarily negligent. We in Congress are not interested in anything like that. State and local governments, after all, are our heroes. We're talking about first responders. We're talking about teachers, our maintenance, trash operators. I mean, you've got to be kidding me. We would leave states and local municipalities and counties out of the recovery. It absolutely makes no sense. Yeah. Unfortunately, in the negotiation of the Big CARES Act and the supplement that we passed just 10 days ago or so, the Republicans in the Senate and the administration blocked further support to state and local government. We are determined in this next package, and this is where I fear we will break down into a more partisan divide. We are determined in the Democratic caucus of the House, our majority, to drive, I hope, $500 billion. We know we've heard from experts what the gap is. In our first bill, we passed $150 billion. The need is apparently about $650 billion at a minimum. I'll give you another example of some group that was, I think, irresponsibly left out, the Postal Service. We begged for, negotiated for support for the Postal Service. And I see my mailman and mail letter carriers every day. Sometimes they have gloves on, sometimes they don't, because they simply don't have it. They are frontline heroes. We negotiated and fought for support for the Postal Service. And I will say that Nancy Pelosi doesn't always do this, but she said very, very clearly that negotiation broke down, not really at the Senate level, it broke down with the president himself. He said, no, I will not sign a bill that includes support for the Postal Service. We'll keep working on that. Again, they're frontline. They are serving you and me every single day at risk to themselves and their families. They need the financial support.
Absolutely. And, sadly with something like this, there's so many people and so many groups and entities and organizations that need help. I mean, this is, not your typical nationwide problem. It's affecting everyone. And I can only imagine how difficult it is to sit down and try to think of ways to help everyone. So I do not envy that position that you're in at all, but thank you for doing that work.
I'm lucky to be in it, and I'm glad that I hope to serve with you. So yeah. I'm lucky to be in it.
Thank you. Well, we don't have you for long, so I know we have some questions, but I just want to touch base on opening the country. So my concern is, we're judging everything, Pennsylvania included, on how many people are testing positive, and we want to see those numbers going down. But how can you truly know how many people are positive if you're not testing everyone? And I just think to myself, we've now are getting ready to partially open part of Pennsylvania, and we have no clue how many people actually are infected in those counties that have been given the green light to partially open. And I'm concerned that we're going to see a huge boost in cases once we start going back to work and going back to normal, whatever normal is at this point. Does Pennsylvania have enough tests right now to be able to safely open? Do you have a feel for that in any way? And do you think that we're on the right path here with the plan that the governor has laid out in terms of opening the state?
Thanks for the question. One of the things I was really proud of was that we drove $10 billion in this last supplement toward testing. I have the same concern that you have. And I have to tell you, I've been watching up close and personal the risk that our healthcare workers are at, whether they're in our nursing homes or our hospitals or in our grocery stores or delivering to us at our door. Here in Montgomery County, because we were one of the hardest hit early on, we were able to get a federally supported testing site. Right now, it resides at Montgomery County Community College, testing 250 tests a day. The federal government attempted to shut that down about 3 weeks ago. We fought that and we got it kept open. But even that is not adequate. I'm glad we have it and we're prioritizing first responders, but it's not enough. We know that we're not testing, number one, the number of people we need to test to know where this disease is, but also we're not testing equitably. For example, the flaw in that very site, I'm pleased we have it, as I said, don't get me wrong, but we're not able to necessarily tap into pockets of populations that don't have a car to drive to that testing site,
right.
Don't have the public transportation. They might fear that that they will have to pay for it. There is no fee. That was part of one of the bills that we passed. Testing is free. But my ambition is until we test very broadly, very equitably, and know exactly how broad this disease is. And we know that what the experts tell us, you test, you find it, you isolate it, you contact trace it, and that's the way you reduce the number and the spread. I don't want us to open prematurely, as I think we're seeing other states do. I am on calls every week with the governor and his administration and Secretary Rachel Levine. I think they have been incredibly responsible. In fact, Secretary Levine got us a mobile testing unit so we can take that into places like Norristown, Pottstown, Cheltenham that might be more densely populated and need more adequacy of testing. But I don't want us to open prematurely, because think of all the sacrifice that all of you have made, all of us have made, much more heroically, all of the first responders have made. Do we want to make that for nothing? by reopening and reinfecting or spreading the infection. So I'm with you on slow and follow the guidelines. Know how far this disease has spread and see the numbers flattening and coming down for 2 weeks or more before more robust opening.
Right. And, what do you say to the people that are protesting right now, about how do you weigh, they have a right to work, people have a right to life, obviously, and people are concerned about how they're going to pay the bills and feed their families moving forward if we continue with the lockdown. So what would you say to those people that are out there protesting, it seems like daily at this point, to reopen when their states say it's not safe?
I would tell them to get on a conference call with me, for example, the State Nurses Association. Hear the firsthand stories of working overtime, taking on extra shifts because so many of our healthcare workers are becoming sick with COVID, of not having adequate PPE, protective equipment. Talk to some of the doctors at local hospitals, see what they think. Talk to the folks at the nursing home where my mother-in-law lived. These are heroes. You want to put them out there at even greater risk of spread? Who's our former governor, head of Homeland Security? I think he said it best. Remind me, why am I blanking? Tom Ridge, Governor Ridge, said that kind of protest is not patriotism. It's simply not.
Right.
What we want to do is responsibly reopen our economy while we are protecting the health of all of us. If this pandemic teaches us nothing else, it teaches us how, in our isolation, how interdependent and interconnected we really are. Yeah. We owe it to one another to wear the face masks, to be socially distant and responsible. And so I also am not impressed with the protests. I think they represent a very small number.
Yeah, thankfully.
So
you've got to leave in just a few minutes. And
could I plug 2 other things I'm working on?
Absolutely, yes, please do.
Because as we're anticipating this next bill, which we're calling CARES 2.0, what I'm fighting for is the increased direct cash to individuals, which we've already talked about. But I'm also fighting for something else, and it is direct cash to businesses, a similar idea that you wouldn't have to apply or qualify. You'd be qualified by being a business of 50 employees or fewer to drive money to the smallest of businesses. You'd qualify by having filed your tax return as a business. So it would be businesses of gross receipts of 1.5 million or less. And you would then get, under our proposal, and there's a similar proposal I'm working with Senator Wyden in the Senate, you would get 30% of gross receipts direct cash to your business, not tied or obligated to payroll, but to try to sustain us in a much longer fashion through the need for rent and utilities and insurance and all the other things that businesses struggle with. The other bill that I'm working on, I'm very proud to have co-sponsored, is direct relief to student borrowers. And this actually was a part of our proposal for the first CARES Act. Our caucus fought for it, but we didn't get it in there. So instead of just the 6 months forbearance on federal student loans, this would be $10,000 forgiveness of student loans for every student borrower, regardless if it's a federal or a state, a combination of a total of $10,000. Our student borrowers were already in need and were overburdened with debt and high interest rates through this pandemic, through no fault of their own. They need relief too. So the direct cash for people, for smallest businesses, and for students, that's what I'm hoping for.
And that sounds amazing, because that's definitely the 3 places where it's needed the most. Student loans, absolutely, you're right, have been overlooked. The forbearance is great, but they definitely were struggling, like you said, prior to this, and this is not helping at all. So thank you for that.
Exactly.
Well, I've tried to work some of the questions that I see popping up here into our conversation. And I know you have another meeting starting right now, so I will not keep you one more second. I wish I had you for longer, but thank you so much for doing this. And
Thank you all. Thanks for allowing me to be with you. I hope we can do it again, Patty.
me too. Thank you
All right.
so much. All right.
Goodbye, Brad.
Thanks, Congresswoman. Good to see you.
Thank
Great
you.
to see you.
Bye, man.
Bye.
Bye.
Thank you.